Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. I'd like to acknowledge the traditional custodians of the land on which I am recording this podcast, the Gadigal people of the Eora Nation, and pay my respects to their elders, past, present and emerging. Well, today we're going to continue our exploration of medical specialists with a very holistic approach to health. And I think I'm really excited about showcasing and introducing you to this type of medicine because it is, after all, a form of medicine that takes into account anatomy, physiology, biochemistry, pathology. It uses nutritional and environmental medicine, which are the drivers. Nutritional and environmental problems are what drives the vast majority of diseases in our modern world, and also incorporates pharmaceuticals into their mix. I think the alternative approach to medicine focuses on two subjects, pathology and pharmacology. And it's for that reason that the pharmaceutical industry has revenues of $1.2 trillion a year. And if you are a person who doesn't think that any of these things are important, you probably wouldn't be listening to this podcast in the first place. But you have definitely an industry waiting to greet you with open arms. But we continue our exploration, and my guest today is someone whose knowledge is far and wide. He is Dr. Jim Bartley, is a specialist, ear, nose and throat specialist for over 30 years. He is Honorary Associate Professor in Surgery at the University of Auckland. He's based in New Zealand. He's written over 60 articles in refereed journals. He's contributed chapters to 17 books and written 2 books himself, Breathing Matters and Healing Headaches. I hope you enjoy this conversation I had with Dr. Jim Bartley. Welcome to the show, Jim.
Thanks very much, Ron. It's nice to talk to you. It's been very interesting hearing some of your other talks. And all I can say is this is all a bit new for me as doing a podcast. I've only done one before.
Well, I'm looking forward to talking to you because we have had an opportunity to have a chat before we've recorded, and here we are. But I just thought we'd start because there's so much, you're an ENT specialist. You've written so many You've written 2 books, you've been involved in so many published papers, but I wondered if you might just share with us your journey. And, I know there are a few aha moments that occur in one's professional life, but how have you got to this point in your career?
Well, I'll start with my journey and a few of the aha moments. When I'd finished my house surgeon years as a junior doctor, I didn't know what I wanted to do. And I saw a job advertised up on the east coast of the North Island. And I thought going up there for the summer would be very good. So I went to a place called Tapuia Springs, which is an hour and a half north of Gisborne. And the moment I arrived, the only other doctor there took off, leaving me in charge of medicine on the east coast. And it was very interesting because when I was there, I had to do my own obstetrics. I was doing some of my own setting of fractures. And the other thing I also was doing was I was giving patients the choice. Did you want to go down to Gisborne to have your tooth pulled out, or should I pull your tooth out up here? So I'd actually practiced on lists in Nelson Hospital before I went up there. So I was also pulling out a few teeth.
Wow, this is character building.
And when you're working in an Indigenous population, because 90% of the population up there is New Zealand Maori, then all I was seeing up there was problem ears. And so I thought, this is really interesting. And then I decided I'd go back to hospital training and become a ear, nose and throat specialist. And I was going to focus largely on Maori ears. So I did my training, and then I went over to London. And when I was there, endoscopic sinus surgery was coming out. And so I went to a course there, and I also went and visited a surgeon over there who was doing endoscopic sinus surgery. So I came back to New Zealand, and my job at Rotorua had fallen through. So I started doing endoscopic sinus surgery. And the problem with endoscopic sinus surgery, it was totally new and considered a waste of time. Now,
this is the passing of a camera, using a camera to guide you.
You stick a telescope up the nose, and you have instruments going up the nose, and it dramatically changed sinus surgery because it meant you didn't have to have a whole lot of cuts on the outside of the nose.
Wow, revolutionary.
And it was at that stage, but one of the things that happened was the textbooks had taught that if you had a pain in your sinus, like your frontal sinuses up here or your maxillary sinuses, if you went in and opened that sinus up, the pain would go away. And the problem was the new technology showed that the pain did not go away. And so all of a sudden I had to try and work out what was going on with these patients. And one of the things I started reading around was trigger points. And so I then started looking at trigger points in the neck and shoulder muscles. I started exploring things like acupuncture, and I also started looking at the psychological issues in relationship to pain. And all of a sudden, I had started a clinic where I was with physiotherapists, where we were working on treating neck and shoulder pain with physiotherapy and a bit of breathing and relaxation work. And the next aha moment was, what then happened was I got invited to work at the pain clinic because I was seeing all these difficult facial pain patients. And one of the things that happened when I was there, I had a patient come in. And what also then happened was the patient came in and I'd heard something on the radio about vitamin D and fibromyalgia. And this lady was an African American lady, and she had uncontrollable pain. She couldn't use her hand because of the pain, and I'd been asked to adjust her narcotics. And I did a vitamin D level on her, and it was 18. And so I then rang up the registrar, how do you prescribe vitamin D? So I gave her some vitamin D, and she came back 6 weeks later. She was forgetting to use the narcotics because the pain was so much better. And the day before, she'd been out water blasting her path. So that was one of these, another aha moment. And the other aha moment I had was I'd be seeing patients coming along complaining that their noses were blocked, and they'd had 3 or 4 operations, and I'd look in their noses and I couldn't find anything wrong. And I thought, if the structure looks okay, how are they using their nose? And I noticed that many of these patients were actually hyperventilating. And as soon as I started treating them to breathe in a relaxed diaphragmatic fashion, their nasal obstruction got better. And then a whole lot of other conditions that they had also got better. And so I then wrote a paper on this, and I also ended up writing a book called Breathing Matters, because what happened was all my colleagues said, this is complete and utter rubbish. Where's the science? So I wrote a book saying, look, here is the science. And it's been that way at least for the last 40 or 50 years. And many of my colleagues have taken it on board, but many of my colleagues also say this is complete and utter rubbish.
I know a lot of professionals feel that's a better way of dealing with new knowledge rather than exploring it. I mean, anyway, but you've said so much here, Jim. My God, we could stop and talk about trigger points and remind or just tell our listener what in fact a trigger point is, because the kind of headache that trigger points refer, is so often described as a sinus headache because it's over the sinuses, isn't it?
You're exactly right. And part of the problem you've then got to do is you've actually got to try and persuade your patient that they haven't got sinus pain because their GP has told them, and all sorts of other doctors have told them. And I normally go through a video presentation. But one of the trigger points, as we were talking about the other day, were first described by a lady called Janet Travell, who was John F. Kennedy's personal physician. And basically, when I see a patient who's got bad headache, I'll find that they've usually got a trigger point in the mid part of their shoulder where they're really sore. I'll normally find that they're really sore all down this muscle here called the sternocleidomastoid muscle.
Down the side of the neck for our listener.
Yeah, it's a bit difficult to palpate that. And the other thing that happens is that often their heads will be way forward, and the tender and the muscles at the junction of the skull and the base of the neck. And it reaches a stage where the patients are saying, how do you know I was going to be sore there? And look, they're also sore in down at the upper part of what's called the scapula, or the bone at the back, and they're often got low back pain, and they've also often got pain in their forearm. And the Chinese have described all this for 2,000 or 3,000 years, because many of these trigger points that Janet Travell described also correlate with traditional Chinese acupuncture spots.
I mean, what a thing for an ENT, ear, nose, and throat specialist to, be aware of. I mean, you would think that would be basic training in your specialty as a differential diagnosis.
Yes, well, I do give that as in the registrar training.
Now,
but one of the problems also is that if I give a talk on this at a conference, I'll probably only get 2 or 3 people because people aren't interested in that. They're more interested in new surgical techniques and ideas. Yeah. And the other problem I also have, as soon as I got interested in facial pain and difficult facial pain patients, all of a sudden my colleagues didn't want to deal with them. They completely dumped them on me. And usually these patients have what's called the thick file syndrome. There's a great big thick file going on. And the other interesting thing that fits in with you, Ron, is when I was working at the pain clinic, I'd also get sent all the difficult dental pain patients. And sometimes working out dental pain can be very difficult. And you'd see patients who had every tooth removed in their upper jaw trying to get rid of the pain. And the pain was no better. Yep. And I can talk a little bit about, as you know, there's a lot of theories about dental pain, and some of them have sort of come and gone. But I can only say that trying to work out dental pain can also be extremely difficult, as you know as well.
Yes. Well, we might do a whole podcast on that one because it really is. And I mean, sometimes if someone comes in with a pain and they've got a big hole in their tooth, it's often, not always, often very obvious. But often it's not obvious. But continuing on this path, sinus headache. Let's just talk for a moment about what is the defining symptoms of a sinus headache. I've always thought it was involving posture. Is that a part of it? If you bent over or postural changes, what defines a sinus headache?
Well,
a real sinus headache.
Where it's related to sinus or just pain over the sinus?
Where it's related to sinus.
Well, they do have there are strict criteria that have been laid down by the American Academy of Otolaryngology, and basically to have strict sinus headache, you've got to have a loss. There are major criteria and minor criteria: a loss of sense of smell, nasal obstruction, infected nasal discharge. You've got to be able to see evidence of infection when you actually look into the nose with an endoscope, or you've got to be able to see it when you on the CT scan if you get a CT scan. And facial pain or facial discomfort is very much right down as one of the minor criteria, and 2 minor criteria make a major criteria. But one of the things that is absolutely definite in my book, because when this all happened to me years ago, when I was trying to work out facial pain and sinuses, I went away and I read all the textbooks going back into the 1920s about sinus pain, where they tried to research it. But if you've got a sinus infection in the sphenoid sinus, that is very, very much associated with facial pain and sinus pain. For some reason, the sinus is a lot more, the sphenoid sinus right at the back of the head is more sensitive. You do see a minor degree of pain with the frontal sinuses, but the sinuses underneath our eyes, our maxillary sinuses, are relatively pain insensitive.
Interesting.
And if you think about it, there was no rational or teleological role for the sinuses to actually get strictly innervated or highly innervated with pain fibers, but you can actually show that there are certain pressures where the sinuses do become painful, but you're looking at about 80 or 90 millimeters of mercury. So you've got to get a very, very high pressure before you'll get a pain, because as you know, some of us, when we've gone flying, patients have had problems with their sinuses, or I've seen divers who have had problems with their sinuses when they've actually gone diving, and I've got a number of divers back to work by just simply opening up their sinuses properly.
And I think it's worth also noting that the molar teeth and the premolar teeth are so intimately related to the sinus that this is where diagnosis of dental infections, which are still pretty common, very common in fact, and I personally, we've noted in our practice the use of 3D X-rays have been absolutely, it's been a revelation to us.
Oh, I always check out the teeth on the CT scans, and if the radiologists get very upset with me because every now and then I point out that they've actually missed an apical abscess going on there. But we could talk. Apical abscesses is another totally different picture as well. Yeah.
Which for our listener is just infection at the tip of the root when a nerve in a tooth has died. Yeah. And that can be painful or it can be not painful, but it's an infection. The other one is fibromyalgia, which you mentioned, and you mentioned responded so well to vitamin D. But fibromyalgia is another one of those very frustrating. They're the ones that come in with a history of many, many pages. Tell us a bit about fibromyalgia.
Well, it's not quite my area of expertise. Okay, but the issue is that vitamin D doesn't have a relationship to it. One of the things that I did talk to a group, the Fibromyalgia Society, that they found really useful, interestingly enough, is actually working on breathing and relaxation. And the fibromyalgia group that I have spoken to years ago said that of many interventions, that was the most useful. The other thing, which is low-dose naltrexone, can also be useful. Naltrexone is an opioid antagonist, and Stanford University has shown that can be useful in some of the fibromyalgia patients. And we get into another very controversial area, and that is the role of diet. And there is certainly a group of patients who find that if they go onto a ketogenic diet, where they get improved energy supply to this mitochondria, they do find an improvement. But we are still struggling to help many of the patients with fibromyalgia.
The other thing you mentioned too was people who have a blocked nose who are hyperventilating, and you look in their nose and there's no obstruction, but there's a biochemical thing going on there, or what's going on there?
What happened, and I've got the graph. I have got a graph to show if people want to have a look at it. Is the Mayo Clinic about 20 years ago showed that nasal resistance was inversely related to expired carbon dioxide levels. So the slower you breathe, the higher your expired carbon dioxide levels, and the more your nose becomes unblocked. So if you can train people to breathe slowly, then their noses will unblock. There's also a relationship to expired carbon dioxide levels, and you can show that if you've got higher expired carbon dioxide levels, you're less likely to have allergy or allergic symptoms going on in the nose. And you can show that different groups of the population have different settings for their carbon dioxide levels. So there are some people who are very anxious, and if they're really anxious and breathing rapidly, their carbon dioxide level is, say, at around 35 or so millimeters of mercury, and they can't hold their breaths for very long. Whereas if you've got Buddhist monks and, say, people who practice underwater hockey, they've set their carbon dioxide receptors to about 44, 45, where the normal is about 40. And so there is a breathing technique out there called the Buteyko breathing technique, where people are taught to breathe slowly through their noses diaphragmatically, and they're also taught to practice breath holding to try and reset their carbon dioxide receptors. And there is one paper out there where they have shown that, this is published in the conventional literature, that if you get people to practice the Buteyko breathing technique, then that actually makes a big difference to their asthma control and a whole lot of other symptoms. So holding your breath, and there's a book out there called The Oxygen Advantage, where the guy actually argues that if you want to improve your performance on the sports field, then you should practice holding your breath, because when you do that, means that you've got more of an acid in your blood, which means through something called the Bohr effect, your delivery of oxygen to the muscles and everything else like that is significantly improved.
Because people think of breathing as being all about oxygen, but actually the key is our carbon dioxide level in our lungs, which you've mentioned the various levels of being 35, 40 or 45 or 44. And that kind of has a really important effect on on acid alkaline. It is, in fact, what balances out acid alkaline in the body, isn't it?
That's exactly right. Basically, sort of the slightly more acidic your blood for everyday use, the better oxygen supply you will get to all the tissues around the body, including the brain and things like that. And you can show not just the tissue delivery, but your delivery of the oxygen to the brain. The artery to the brain opens up directly in relationship to the carbon dioxide levels in the blood. So as soon as you start hyperventilating, you can actually you start constricting the arteries to the brain, and people start feeling faint. And I had that experience myself, where I was climbing Kilimanjaro, and I was going around something called the Barranco Wall, and I must have started to hyperventilate because my oxygen was already a bit low at 80. And all of a sudden, my head was completely swimming.
Oh, wow.
And I don't know whether you were a schoolboy, where you used to have this trick when you're a young schoolboy, where you'd hyperventilate and then you'd hold your tummy so that you prevented oxygen from getting to the brain, and then you'd faint in the playground. Now, that was something we used to do as a fun thing. I don't know how
party trick.
I've done that as a party trick. And there's also something, I'll tell you another story then, shallow water blackout. Because what happens is if you hyperventilate and then go down diving, by hyperventilating, you've actually constricted the arteries to your brain, and then all of a sudden the carbon dioxide levels go up and you black out. And we were diving once with a friend, and it was a friend's anchor down the bottom, and it was stuck. And I sort of said to this guy, well, I'll go down and get it. So I started hyperventilating to get down there. And the guy said, don't do that. You'll get shallow water blackout. So I went down, I retrieved the anchor, and I could see the bubbles on the surface. And the next moment, a friend was giving me mouth-to-mouth resuscitation on the surface. Because obviously, he said I got to the surface, and then I started dropping, and he thought he didn't know whether I was having him on or not. And he came over, picked me up, and started giving me mouth-to-mouth resuscitation. Yeah.
God. Now, that whole thing about hyperventilating and people pass out, or they put a paper bag over their mouth to rebreathe this is all about that carbon dioxide balance. But there's another one that comes with nasal breathing too, which is not just carbon dioxide level, but there's another gas that we need to be, or compound that we need to be familiar with, which is nitric oxide too. That's an important one as well, isn't it?
Yeah, well, nitric oxide is a very interesting gas, and most of the nitric oxide that we inhale comes from our noses. And when we inhale nitric oxide, it goes down into the lungs, and it improves ventilation perfusion. That's the gas going to the blood. And if you've got nitric oxide actually in your bloodstream, when the capillaries or little blood vessels get to the final part, the nitric oxide comes off and then dilates the blood vessels. And of course, one of the very popular medications, Viagra, is a nitric oxide inhibitor. So it improves the nitric oxide supply to the male genitalia, and we get a corresponding result. There's also a very interesting relationship between what we're eating, and if we have sort of beetroot, for example, we increase the amount of nitric oxide that the body gets, and that is said to improve athletic performance. And if you go out to the sports drink places, there's a lot of beetroot drinks to improve nitric oxide performance.
Wow. Go on. No, go.
And there's also another interesting thing that happens is that when you hum, the sinuses somehow vibrate and actually improve nitric oxide delivery into the nose. So if you're actually humming, you're improving nitric oxide delivery. And there is one study published a couple of years ago where they got yogic people to actually hum. And when and people with chronic sinusitis, if they hummed, they got dramatically better with their symptom score with respect to sinusitis. So no one's ever looked at it any further, but going around humming could be an important treatment for chronic sinus disease.
I also read that after the SARS-1 virus, there was an article in the Journal of Virology which was amazing. It made the statement that nitric oxide disrupts the reproductive cycle of the SARS-1 virus. So it's also antimicrobial, isn't it? Or antiviral.
No, I never followed it up, but they were looking at it as a treatment for COVID. Mm-hmm. And it doesn't get applied in adults, but for neonates, they'll actually add nitric oxide to the ventilators to improve the ventilation and reduce the atelectasis in neonates young. So it is recognised as a treatment. But one of the problems we do have is that if it's too high a dose, then you can get side effects from it being too high. And people with asthma, some of them actually produce, because of the inflammation, do produce high levels of nitric oxide. And so on the other side of things, it is used as a marker of asthma inflammation or inflammation in the lungs of asthmatic patients.
Oh, right. Okay. Interesting. Another area, while I'm consulting with the ENT specialist, another area that's often interesting is tinnitus. And I'd love to hear your view on tinnitus, because it's a frustrating problem for many people and practitioners.
Well, one of the problems with tinnitus is a bit like facial pain, is that people run a mile because unfortunately there aren't any quick and simple answers. I saw something advertised the other day, but I didn't look at it. I've looked at all sorts of options, and certainly if you've got a hearing loss, then about 50% of patients benefit from hearing aids. When I had trained, one of the treatments was actually breathing and relaxation work as an effective treatment. And one of the other options is trigger points or tender spots, particularly in the sternocleidomastoid muscle, but more in the masseter muscle here, associated with tinnitus. And I have had only a few patients where we have looked at trying to work on their breathing and their posture and reducing the tension in their muscles, and the tinnitus has got better. Now, the other thing that's also happened is that the audiologists have got into cognitive behavioral therapy, where they play sounds to patients in their ears and they try and get them to relax and get their brain to actually adapt to the tinnitus so it's less stressful. But one of the things that happens is that in a very, very quiet room, if there's no sound coming in, 80% of people will get tinnitus. So sounds coming in turn the volume control down in the brain. So one of the things we often tell people to do if they're having tinnitus and having difficulty going to sleep, just a little bit of soft music will actually turn in the background as they're going to sleep, will actually turn their tinnitus down.
Yeah, because I know whenever I've been dealing with people with headache, neckache, jawache, and tinnitus, I always say, in order of easiness, getting rid of the headache, neckache, and jawache, I think we could get a quicker result. Tinnitus is frustrating, but it's interesting to hear you say that as well. Vitamin D. Now, to hear you be so focused on vitamin D, and I know you've written on it in various journals, is such an interesting one, and I was really impressed by how widely you've explored this. You mentioned that one woman who had a level of 18. What is an ideal level of vitamin D? How common are deficiencies?
Well, it depends on how you start defining deficiencies, but one of the things that happens is if you go and look at animals in the wild, so look at chimpanzees and monkeys and things like that, they have vitamin D levels about 140 nanomoles per litre. And if you start looking at traditional tribesmen in the jungle, they have levels of about 120 nanomoles per litre. And if you look at has been discussion about what is an optimal level, but the books talk about a level of 50 nanomoles per litre. And one of the interesting things is you can show, if you graph it out, that you start getting benefits around sort of 75, even up to 100 nanomoles per litre, with a variety of health conditions, and that includes a reduction in cancer, mainly sort of breast and colon cancer. You can show that walking time improves. Vitamin D has a role in muscle strength. And you can also actually show, if you look at gum retraction, that vitamin D also influences gum retraction up to about 80 to 90 nanomoles per litre. But one of the fascinating things is that we've known for over 100 years that vitamin D prevents tooth decay. And these were studies done in the late 1920s in boys' homes in New York, where they gave some group vitamin D and the other they didn't give vitamin D to, and they had exactly the same diet. Everything else was the same, and there was a dramatic reduction in tooth decay. And you can actually also do just graphs going down the states, and you can show the further north you go, the higher instance of tooth decay, and the closer you are to the equator in the states, you have less tooth decay. So there are numerous studies out there showing that taking vitamin D prevents tooth decay, and we hear absolutely nothing about it. The other interesting one is there is a study out there showing that if your vitamin D levels are relatively high, and that is actually only above 50 nanomoles per litre, and this was a study out of Israel, and you can show that people with COVID often have low vitamin D levels, but is that a cause, or is that an effect of the COVID virus? And so they looked at vitamin D levels 3 months and earlier, and basically 3 months and earlier, if you had a vitamin D level of greater than 50, your risk of severe COVID was about 3%. If your level was 50 nanomoles per litre, your risk of severe COVID was 24%. So there is a dramatic improvement if you can get your vitamin D levels up sensibly. And a petition went to the British Parliament saying, look, let's look at vitamin D supplementation for COVID. And this was over 100 respected doctors, and it was completely turned down by the British government.
Yeah, no, we had the same story here in Australia, and most recently there was a government forum on treatment of COVID. 26 months after the beginning of the pandemic. It came a bit late, but vitamin D levels are it's too simple, it's too cheap, it's not promoted by the pharmaceutical industry, so it is of no interest to the majority of the medical profession. Sadly, very sadly, it's a topic we've covered a few times on this podcast. Jim, I know this sounds obvious too. You're an ENT specialist, and of course you would be interested in breathing, but no, it's much more nuanced than that. You've written a book on it, Breathing Matters. Just remind us what breathing well is. How do we define it?
Well, we breathe according to different situations that we're in, and if we are meeting a situation of stress, brief stress, one of the things that we would do is that we would breathe rapidly in our upper chest, and what that does is that would make our bodies alkalotic, and when our bodies became alkalotic, then our nerves, our muscles would react faster, and also our brain would react more quickly. But if we do that on a long-term basis, we can run into problems. Now, if you actually inject bicarbonate into horses and athletes, you can make them alkalotic. And you can show that if you inject athletes or horses at the beginning of a race, they will actually perform better. But as one horse trainer said to me, it's not the beginning of the race that's important, but the end. And
you still need to be in front at the end. That's the critical point.
You'd see his horses take off with the bicarbonate in, and I'm not totally up with it, but it's not allowed to be done as part of horse doping. But when we're designed to breathe and relax, and that's when our immune system takes over, and when we're sort of looking at body recovery, then we are designed to breathe in a relaxed fashion diaphragmatically, and that involves our abdomen's sort of moving, and when it moves, we actually get a circumferential expansion of the abdomen. When I start off teaching people to breathe, and I don't know whether you want me to stand up.
No, it's okay, because this is audio too, so you just describe it.
What happens is that they just push their abdomens in and out. And that's what we have to do to start. And I've already seen a patient today, and she could not breathe in a relaxed diaphragmatic fashion, lying down relaxed. And in that situation, we then look at other ways to try and encourage relaxed diaphragmatic breathing. And that involves bending the knees up to relax the abdomen. If you put your hands behind the head, it also helps just relax the shoulders a wee bit. And I learned this about 6 months ago. When I get people to do that, I will often get them to try and breathe through their noses with their tongue up against their hard palate. But if you're really desperate, if you start getting people to breathe through their mouths, that can be a start of trying to get them breathing in a relaxed diaphragmatic fashion. So if you can breathe in a relaxed diaphragmatic fashion, you can show that the amount of oxygen that is delivered to the blood is increased. And this is just, once again, J.B. West's Respiratory Physiology, which is a fundamental respiratory physiology textbook, shows that if you can breathe in a relaxed diaphragmatic fashion, it takes 3 to 4% of your body energy. Yet if you're hyperventilating up here, it takes up to 30%.
Wow.
Of the energy in your body. So just working on your breathing is a great way to actually promote conservation of energy, and that might be one of the reasons why fibromyalgia patients possibly have found it so useful.
Wow. And of course, this mouth breathing, nasal breathing thing, which is, very common, is another aspect to this whole picture as well, isn't it?
Well, as we've talked about, we've got nitric oxide. But basically, we were designed to actually breathe through our noses most of the time. And if we start breathing through our mouths, then we actually change the overall resistance in the body. And there was an interesting study out, which was published in The Lancet about 15 years ago, where they saw people who had fractured jaws. And so what they then did is they measured their oxygen levels and their lung functions, and then their jaws all got wired up for 6 weeks while their jaws healed. And then they measured their lung function tests and their oxygen levels before they took the wires off for their fractured jaws. And I find this really hard to believe, but the oxygen concentrations in the blood went up 4 or 5%, and all the functions of lung function improved. Total lung capacity improved by 5%. And you can also show, this is what they do in the laboratory, if they get athletes and they get them to breathe solely through their noses or solely through their mouths by putting clamps on, that the oxygen extraction improves with nose breathing and the carbon dioxide excretion improves with nose breathing as opposed to mouth breathing. So basically, physiologically, if we breathe through our noses, we improve oxygen delivery and carbon dioxide extraction from our body.
Look, the more I hear about the breathing, the more amazing I think it is. And particularly the diaphragm. Jim, I had an integrative gastroenterologist, Dr. Pran Yoganathan, on when I asked him about acid reflux, big seller of protein pump inhibitors and antacids. He said it was a function of, he felt in the majority of cases, it was a function of diaphragmatic sarcopenia or underdevelopment of the diaphragm. And I thought that was really interesting.
Well, once again, that's all been published about 6 or 7 years ago. There was a paper in the American Journal of Gastroenterology.
Right.
What they did is they got people with reflux and they put a pH meter in their lower esophagus and then got them to change their breathing, whether they breathed in their upper chest or whether they breathed diaphragmatically. And as soon as you started breathing in your upper chest, you showed acid going up into the lower esophagus. And what they then did is they got these reflux patients, to go away and practice relaxed diaphragmatic breathing and worked on it. And 3 months later, the use of antacids and proton pump inhibitors had gone down 70% in those patients who were able to practice good, relaxed diaphragmatic breathing.
Wow.
It's not quite my area of expertise, but I do see patients with reflux, because quite often if you get reflux, you can get acid coming up here, and they come along complaining of lumps in the throat and throat discomfort. And I've only got a handful of patients, but I've had a number of patients who've gone away, they've worked on relaxed diaphragmatic breathing for their reflux, and it's made a dramatic difference.
The other podcast, I'm mentioning it to you because I know you're going to might come up with an interesting perspective on it. We did one on men's health, and when he said diaphragmatic breathing improved pelvic floor tone, which is particularly important as we all get older, but women also after they've had a child. That was interesting too. I mean, the benefits of diaphragmatic breathing run through the whole body, don't they?
Well, once again, yeah, the pelvic floor becomes important because that gets stimulated once again by the diaphragmatic movement. I don't have a lot of knowledge of it, but I do know that respiratory physiotherapists, when they're dealing with people with pelvic floor problems, do work on relaxed diaphragmatic breathing to try and help patients with pelvic floor tone. The only other comment I'll make is if you're a top-class female athlete, you've actually got really, really good pelvic floor tone. And these top-class athletes sometimes have difficulty when it comes to delivering babies because their pelvic floor tone is so high.
Interesting. Now, listen, if you were going to leave our listener with a few hints on improving their health in general or breathing in particular, what would be some of the things you'd recommend to people?
Well, a very, very simple one is actually thinking about sensible sun exposure and taking a little bit of vitamin D. Now, you can show, and this is a meta-analysis in the British Medical Journal, that if you take regular low-dose vitamin D, and I take sort of 2,000 or 3,000 IU a day over the winter, then that dramatically reduces your risk of respiratory infection, and it's twice as effective as the flu vaccine. That's looking at protective data. The flu vaccine data I'm quoting comes from the Cochrane database, which is the most rigorous source of evidential-based medicine. And the study I'm talking about has been published in the British Medical Journal. So if you really want to have a good winter, and I've never had a day off work being sick. I've broken a few bones, but never off sick. Then taking a little bit of low-dose vitamin D, 2,000 to 3,000 IU a day, or going out in the middle of the sun and seeing a little bit of sun, because that will also help your melatonin and your sleep. And the next one, and it's a bit harder to actually talk about, and that is thinking about your breathing and where you're breathing. And certainly what does happen is some people go away and they practice their breathing, but it takes 8 to 10 weeks to change everything. And so that can help people with their sleep and their sleep quality. And if you're a meditator, relaxed diaphragmatic breathing is one of the prime things that you do when you're actually breathing. And that also makes a whole lot of difference to other electrical activity in the body. You can certainly show that it changes something called heart rate variability, which relates to the contraction of your heart. And there are also some very interesting studies, which I haven't been able to find again, whereas if you're breathing in a relaxed diaphragmatic fashion, you can actually show that your brain wave activity becomes synchronous with your breathing pattern. So there may be a degree of sort of synchrony between the heart rate variability that is being generated by your breathing pattern and your brainwave activity.
Now, I just wanted to pause at this point, and this is for you're watching this on YouTube. And when we were doing the podcast, Jim included his screen share and showed some really interesting slides, which I wanted to share with you. So this is just an additional part to our podcast where Jim shares some very interesting insights.
This is a gentleman in the 1700s, and he was a tailor, and he spent all time inside working, and his bones got very soft because he spent all his time inside, and he got osteomalacia. So that was one of the earliest cases of described of osteomalacia.
Wow. I mean, he looks like a rag doll.
Yeah. So the next person I've got here is a chap called Neil Finson, and he won the Nobel Prize in 1903, and he was curing people with ultraviolet light. And that's a picture of tuberculosis of the skin before and after treatment with ultraviolet radiation. I show this because this was why we had all the tuberculosis sanatoria up in the hills and in the mountains, where you'd get more vitamin D because there's less filtering ozone. And you could show before the drugs came in that 70% of people with tuberculosis got better practicing regular sun exposure in these sanatoria up in the mountains and up in the hills.
And we're seeing there a whole bunch of kids sitting out on a balcony with their swimming costumes on, or barely actually, to get as much sun on their skin as they possibly can.
And if you actually looked at some of the older hospitals, they all had balconies around them. where the people got wheeled out in the middle of the day to try and help promote their recovery. And once again, you could show that people, interestingly enough, if you've had a heart attack and if you're by a window, then you're less likely to have problems with your heart than if you're in an enclosed environment. And Florence Nightingale in the Crimea War, all the people's wounds had to be exposed to the sun. And also in the First World War, if you had a bad injury, once again, your wound got exposed to the sun to help recovery.
Yep, amazing.
And we've just talked about all sorts of things in relationship to vitamin D. We've already mentioned muscle strength. And if you're a top-class athlete, then you actually try and get your vitamin D levels up if you're a black American, because you're less likely to have muscle injury. And you can show that the further north you go, if your mother's vitamin D deficient in Canada, you're more likely to have a schizophrenic baby. We've known for years that multiple sclerosis is more common the further away you are from the equator. I also got interested in this partially because if I see an Indian patient, I'll often ask them if they've got low back pain, and as soon as I give them vitamin D, their low back pain will actually get better.
Wow.
So if you see a dark-skinned person with low back pain, giving them vitamin D will often help people with low back pain. And we've mentioned this graph before. And if you're a primate, you've got a blood level of vitamin D of 160. If you're living out in the wild, you've got a vitamin D level of 120. And if you're a Canadian living indoors in winter, you've got a vitamin D level of about 40.
Gosh, yeah.
And here's another graph looking at vitamin D levels. And you can look at, there's colon cancer, looking at walk time, fracture risk. And you can basically show that if you look at that up to sort of 100, you seem to get gradual improvements in your reduction in colon cancer and attachment loss. So that's your gum retraction on the teeth. Your fracture risk also decreases, and your risk of colon cancer also goes down up to about 100. And once again, that was published 15 years ago in the conventional literature.
Isn't it interesting, though, Jim, about how this slip in Australia, we have the slip, slop, slap, and I see parents down at the beach with got their kids in rash tops from head to toe and a hat and zinc cream on their face, exactly the opposite of what you showed in that hospital scene.
Well, I can only say that there's more money to be made in selling selling zinc and all those sorts of things than there is in telling people to have sensible sun exposure without getting sunburnt as protecting you against a number of diseases and conditions. And there is a very interesting relationship. You can show, this was published in American Servicemen, those servicemen who had a high incidence of skin cancer had a lower risk of all the other cancers combined. And so the message to protect yourself against the sun is actually probably promoting all the other cancers as opposed to protecting against skin cancer.
Yeah, so it's about really finding that balance rather than throwing the whole baby out with the bathwater.
And that's just showing the vitamin D levels, average vitamin D levels in New Zealand. And as we get older, our skin doesn't make vitamin D so well. Below Hamilton, which in the upper half of the North Island, over the winter, you just can't make any vitamin D as well. And you can see that depends on what your criteria are, but the dark skin races are far more likely to have low vitamin D levels. And it depends on your criteria, but you're looking at 50% of the New Zealand population, if we lose a, say, criteria of 75, having inadequate vitamin D levels.
I think that would not be that different in Australia.
And for what it's worth, we're going into some other graphs here, and this is that thing there on the left is nasal resistance, and at the bottom is expired carbon dioxide levels. And if you consider that 0.04 is a normal expired carbon dioxide level, and then if you look at 0.07, you can show that if you're blowing off if you're slowing your breathing down, and I'm going to get this wrong, but basically there's a direct relationship between your expired carbon dioxide levels and nasal resistance. And once again, these are papers And I can only say that Barodi was one of the top rhinologists in the States, and the higher your expired level of carbon dioxide, the less allergy you're likely to have.
Which means slowing it down.
Slowing it down.
Yeah.
This is once again showing a baby in the uterus. There's the ribs, there's the liver. All babies come into the world breathing in a relaxed diaphragmatic fashion.
Wow.
And for what it's worth, again, this is our lungs, JB West Respiratory Physiology. You take in 4 mils of oxygen per minute up the top of your lungs, and you take in 60 mils per minute down the bottom of your lungs. So for maximal respiratory efficiency, we're designed to use the bases of our lungs.
Yeah.
Hopefully that's okay. That's it for the moment. We'll just leave it at that. Thanks, Ron. Yeah.
That's great, Jim. Thank you. That was.
Oh, we're finishing off. This is JB West Respiratory Physiology.
Yep.
Once again, classic textbook saying that if you breathe relaxed diaphragmatic fashion, there's 3% of the oxygen in your body, whereas if you're hyperventilating, it takes up to 30% of the oxygen in your body.
That's an amazing statistic. And I mean, it seems so obvious, doesn't it, that if you have got a set of lungs that are there to exchange gases to deliver energy around the body, why not use all of it?
Yeah.
I mean, it's just so simple, but it's often overlooked. Now, listen, we just want to finish up. One last question, because we are all on a health journey in this modern world as individuals. And so taking a step back from your role as a medical specialist, as an author, as a teacher, what do you think the biggest challenge is for us as individuals on that journey?
Yeah, I've got to stop and say it's a very good question, because I have to stop and think about it. And I think one of the big challenge is that when you start talking about vitamin D and you start talking about breathing, even to your friends, people will look at you as if you've gone completely mad. And what I do is, if I say to a patient that I have discussed, say, vitamin D supplementation, or I've discussed breathing and relaxation work with the patient, I will actually often put the specific references down at the bottom of my letter to the GP, so the GP can't turn around and say, well, you're not practicing scientific-based medicine. So when I tell people that it might be useful for their reflux, I then put the reference at the bottom of the list. If I say vitamin D might be useful for eczema, then I put the reference at the bottom of the list. And the problem is that many of your GPs, or many of even your hospital specialists, aren't aware of they're not up to date with the conventional scientific literature, because the thing that gets taught at medical school is drugs and operations, and nutrition and other issues like that don't receive a lot of time.
Yeah. Well, Jim, that is exactly why I was so looking forward to having you on here today. And we've learned so much, and I want to thank you for joining us and sharing your knowledge and your wisdom with us. Thank you so much.
Thanks very much for the invitation, Ron. It's a pleasure talking to you, and hopefully we'll stay in communication.
Every time I speak to somebody about breathing, I learn something new, and I've been interested in it for a long time. I hope you find it interesting as well, because as the world we live in becomes increasingly more complex, a theme of this podcast is that many of the solutions to enjoying good health are remarkably simple, cheap, accessible, and most importantly, effective. And what can be more accessible than focusing on breathing? And it's why sleeping and breathing I consider on this Unstress podcast, in my Unstress Health program, to be foundational pillars. And Jim kind of reinforced that. Also, vitamin D. Here it comes again. Vitamin D. Vitamin D, we've spoken of before. We're going to do a whole program on vitamin D. It keeps cropping up in every element of health because, like thyroid hormone, vitamin D receptors and thyroid hormone receptors are on every cell in your body. And that is why vitamin D is critical to reducing physical and mental health problems. So Jim kind of reinforced that in spades and reinforced the power of good breathing. Now, I'll have links to some of Jim's books, Breathing Matters and Healing Headaches. and we'll be following up on these themes in coming podcasts. So I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.